In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do.
Ora questo è il momento di compiere un passo in più. Quello più importante. L'Italia rimarrà sempre una zona unica, l'Italia protetta, ma ora disponiamo anche la chiusura di tutte le attività commerciali, di vendita al dettaglio, ad eccezione dei negozi di generi alimentari, di prima necessità, delle farmacie e delle parafarmacie. Rimaniamo distanti oggi per abbracciarci con più calore, per correre più veloci domani. Tutti insieme ce la faremo.
Cara Italia, cari italiani, in questo momento così difficile vorrei dire a tutti voi che lottate contro il virus che non siete soli. Il vostro sforzo e il vostro esempio sono preziosi per tutti i cittadini europei. In Europa stiamo seguendo con preoccupazione, ma anche con profondo rispetto e ammirazione, quello che state facendo. L'Italia è parte dell'Europa e l'Europa soffre con l'Italia. In questo momento, in Europa, siamo tutti italiani.
Travel restrictions on China and put in place the first federally mandated quarantine in over 50 years. We declared a public health emergency and issued the highest level of travel warning on other countries as the virus spread its horrible infection. And taking early, intense action, we have seen dramatically fewer cases of the virus in the United States than are now present in Europe. The European Union failed to take the same precautions and restrict travel from China and other hotspots. As a result, a large number of new clusters in the United States were seeded by travelers from Europe. After consulting with our top government health professionals, I have decided to take several strong but necessary actions to protect the health and well-being of all Americans. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight.
We've done what can be done to contain this disease, and this has brought us valuable time, but it's now a global pandemic, and the number of cases will rise sharply. Indeed, the true number of cases is higher, perhaps much higher than the number of cases we have so far confirmed with tests. And I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous, and it's going to spread further. And I must level with you, level with the British public. More families, many more families, are going to lose loved ones before their time.
Cette épidémie qui affecte tous les continents et frappe tous les pays européens est la plus grave crise sanitaire qu'ait connue la France depuis un siècle. Dans l'immense majorité des cas, le Covid-19 est sans danger. Mais le virus peut avoir des conséquences très graves, en particulier pour celles et ceux de nos compatriotes qui sont âgés ou affectés par des maladies chroniques comme le diabète, l'obésité ou le cancer.